Okay. Good afternoon, everyone. I'm really it's watching, and it is quite a humbling experience to listen to people who have suffered. And as I was hearing about the vaccine which I'm giving trials, Covishield trial, I think so. This similar occurrence was observed during the trials of AstraZeneca in USA. A young woman had the convulsions. She was a trial participant, and then the vaccine was not licensed in the US. In the European countries also, after some time, it was banned. Firstly, it was banned for young people because these strokes and this VITT was found particularly more in young females, and of course myocarditis in males, so it was banned. And unfortunately, in all countries, we have majority of us are young people. 97 of the population are of age, and they whether they were at risk or not. I will just try to present some data. I will just share this slide. I try to present some data to. So I will just present some data to just complement what others have spoken. So this is the futility and what are the possible harms. And now we know with accumulating evidence, the harms are almost real harms. It's not possible any longer. So first question in epidemiology is whether vaccine was indicated, mass vaccination that is. So it depends on the infection fatality rate. We will go through it, and the risk stratification, whether the younger people, healthy young people, will try to answer that with data, and also the natural immunity, which was downplayed throughout the pandemic. So this is another, I would say, almost indicate no indication was not there in the people. They were given the vaccine or other forced by poison. And the efficacy of the vaccine, some real world data. I will be rapidly going through some graphs. And the safety issues which are gradually coming up, vaccine induced thrombotic, which has been even admitted by the manufacturer, AstraZeneca, blood clots. It is too little, too late. So many like subtypes also, young adults, Guillain-Barré syndrome. I think the Covishield trial in India, the young male had Guillain-Barré syndrome. Spike protein in different organs. I heard someone say about the different organs. So there are some concerns that this sometimes the vaccine is injected in the muscle, but if it goes to the other sides, dissemination in other organs, the spike proteins can harm. Long term, we are yet to know. So this is this data. This is about the infection fatality rate. If you see up to 19 years, the infection fatality was 0.0003%. That is almost negligible. More people are dying from traffic accidents, young people. Then up to the age of 69 years, the infection fatality was 0.05%. Actually, I have zero point 0.1 or 0.05%. Overall, up to the age of 69 years, overall the infection fatality was 0.03 to 0.07%. So this actual after infection, as we know from our experience also in India, majority of people got infected because the vaccination was rolled out, and the deaths were inflated also. As Venugopalan also brought out, anyone with a positive RT-PCR was labeled as a COVID death. So up to 69 years of age, overall mortality was 0.03%. So definitely there were to roll out mass vaccination, and this is available 4 months or 5 months into the pandemic. Early 2020, this data was available, and they could have moderated the response based on this data. So the low infection was based on serosurveillance few months into the pandemic, and it was published in a WHO journal, given the reference. And the rationale that other rationale they gave was okay, children are not risk, young people are not risk. But if to break the chain of transmission, we have to vaccinate the young people. So this also the study showed that this rationale was also not on firm evidence. Paper Studies as early as August 20 show that children were the virus from adults and not vice versa. Sweden is a good example. It kept its school open throughout, and there was no higher morbidity or mortality in children. Out of 1 lakh children, more than 1 lakh children were followed in Sweden. Only 10 or 12 required hospitalization, and all survived. And that much dreaded and hyped that multi-inflammatory syndrome, only 3 or 4 child got it and they all recovered. This multi-inflammatory syndrome is found in any viral infection. It is not specific for COVID. Now we hear the propaganda of long COVID, long this, long that. Any viral infection can give some sequel in some people. So they made COVID as a it is a larger than life disease infection. So then again, a question of naturally acquired infection. They downplayed it throughout, and the studies from Cleveland Clinic in USA and studies from Israel have confirmed that naturally acquired infection was 13 to 26 times more robust than vaccine-induced immunity. And by the time vaccine was rolled out in India, most had already acquired natural infection. Particularly the young people, zero summit in Delhi and other Gujarat, so 80% of young people had those antibodies, and even after the second wave, 70% of Indians had overall antibodies, which indicate that 80% might have already got an actual infection because the antibodies come down after some time, but the T cell memory, T cell driven immunity persists. So this almost everybody had a natural infection, and this was not only no logic, no science. It is defied even health economics. I mean, crores of rupees, I think around 350 crores rupees was spent in this vaccine, right? Which could have been used for other. And with mass vaccination, 33,000. 35,000 crores rupees. You can imagine the futile waste and it caused harm. The published reports are found about the incidence of serious adverse effects. That is 1 in 800 in COVID mRNA vaccines, and Covishield is a higher rate. So even if you go by conservative estimate of 1 in 800, if you have given vaccine to 100 crore people, as you have got the whole lot of people praise India for 100 crore. So if you vaccinate 100 crore people, the estimated serious adverse events would be 1 in 800. That comes to almost 12 to 13 lakh people might have had serious adverse events. This is the published papers. So, and 1 in 800 is a large figure at the population level. What happens, the clinician, a single clinician does not see 800 patients. He may see 100 patients, 200 patients given vaccine, and he does not see any adverse effect. So he thinks there is no adverse effect. So a clinician's point of view is entirely different. Whereas if you see the population level data, this should have been monitored. The pattern shows that many people, 100 crore, if suppose 13 lakh people have serious effects and 3 4 lakhs deaths that must have occurred out of the serious. So that is a huge figure as Mr. Venugopalan brought out. The AI system is rudimentary, or it is rather to support the vaccine drive rather than to identify the hazards. It is just like running a super fast train throughout the country without in old rickety tracks. We don't have forget about AFI. We don't have health systems in place in the rural area, remote areas. We don't have adequate public health infrastructure, and the health care workers are not trained to identify adverse effects. So these are some of the and in spite of all this, so many crores spent, so many rolled out, but did the mass vaccination bring down cases and deaths? So a published paper early in the year after the mass rollout from 68 countries, they compiled data from 68 countries. This is a good journal, European Journal of Epidemiology. 68 countries and 2847 American counties did not show any correlation with the level of vaccination and the incidence of COVID. And this is even granular level papers are showing, and as Mr. Venugopalan brought, Africa had the lowest vaccination rate, more less than 5%, and they had the least cases and deaths, and the European countries are having the highest in spite. So country as a country, there were peaks in cases, and then some data which I have been trying to present for the past 2 years, I have published also. that just data compiled from the public domain. That is world in data, the vaccination coverage and the worldometer, COVID incidents and deaths compiled from that. I have just plotted 1 year before the vaccination and 1 year after the vaccination. I had published it 2 years ago, and this year in March I presented this data on invitation from AIMS New Delhi and National Academy of Medical Sciences India. And I presented it and I asked everyone there, the most leading doctors in the country, in New Delhi platform, that I would be very interested if anybody can explain this paradox and or reverse this. To date, I have not received any. I will rapidly go through the slide. So then, as you are aware, there is a mathematical models which are inflating the panic of COVID and the benefits of vaccination. So there, the paper came according to models, vaccine saved 20 million lives. This is a paper in Lancet which has been funded. The paper funding has authors got the funding from Bill and Melinda Gates Foundation. So, and the models, we know the Neil Ferguson's model also. That also predicted doomsday. So we are still going, the policymakers are still taking cover under model. So I just plotted the real world trends and country after country. We start with Japan because Japan is very interesting. This is the red circle, red semicircle is the rollout of the vaccine. 1 year before the rollout, there are no cases, no deaths, Japan, almost. And it did not have a very strict lockdown also. And if you see after the rollout of the vaccine, the cases started peaking. You see 1 year afterwards. So this vaccine, left side is the before vaccination, right side, this is the population level number of cases. Then the other claim is okay, it will prevent deaths and hospitalization. So this is the death from COVID in Japan. Before vaccination, there was of course one peak before vaccination, but if you see after vaccination in Japan, there are one peak, two peaks, three peaks, four peaks. So this is up to I have just started 2022. Early the mass vaccination did not have any effect on the population level in Japan. So these are the many countries. Any country, this is Israel. Israel was given the Abasi because they said Israel was the first one country to have the largest vaccination cover. So you see Israel where before vaccine you see the cases and after vaccine all the cases are coming. I mean I am really surprised for the 2 years I am presenting this data and no country the country should have claimed the refund from the manufacturer. This vaccine has not worked at the population level. At least what is the data showing? These are the deaths in Israel. There's hardly before vaccine 1 year and after vaccine there are peaks in deaths. And naturally it comes down on its own because all the vulnerable deaths, those who survive, they develop natural immunity. Australia is again a very good example because Australia had no cases before the hardly thousand or two, very in thousands because they had a very strict island. They had a very strict barrier. Anyone unvaccinated cannot come. Even the tennis player could not come. So you see, nothing happened. Cases because of the strict, almost draconian measures. There is no cases. But after the vaccination, the Australia having the cases. This is the cases, and then you see the deaths. Majority of the deaths in Australia are after the vaccine. Here, 1 year before, 1 year after. So this is Australia. And these countries are having second booster, third booster. And in Australia, data only shows that the AstraZeneca was more harmful than the mRNA vaccine. They had some data monitoring. Singapore, again a good example. It was a small country. Before vaccine, hardly any cases. After vaccine, right side of the red, all the cases after that. So the immunity doesn't last. So it's all waste of money. These are the deaths in Singapore. All the deaths are, why the countries are keeping quiet, I don't understand. This data is available in the public domain. This data is not fabricated. This data is not cooked up. These are from the worldometer data and the world in data. This is the vaccination coverage and this is Malaysia. See, Malaysia also having same left, right. Whatever country I compile, this is the deaths in malaria or Malaysia. All the deaths after vaccination. Similarly, South Korea. It was also lauded for its strict control, and after vaccination, they had cases. This is deaths in South Korea. Taiwan was also lauded for its strict control, and after they rolled out the vaccination, the cases occurred in Taiwan on the right side, and all the deaths in Taiwan are after the vaccination. Before the vaccination, not a single death. So these are the some patterns which are really paradoxical. Sri Lanka, I was very carefully following because Sri Lanka was a neighboring country. If you see the cases before 1 year before, hardly any cases, and the cases flared up after the vaccination in Sri Lanka. Similarly, the deaths, all the deaths after the vaccine. And who is doing this? Who is doing any AFI? It's not only in India. All over the world, adverse events monitoring is suppressed. They say even in the developed countries, less than 1% of adverse events are investigated or reported. But the population level data shows peaks after the vaccine. We don't know why. So these are that is the population level. As far as the data is showing, it did not have any impact on the population level. Then concerns about the safety, as you know, we have pericarditis, Guillain-Barré, and the viral AstraZeneca is a protein disorder, scope, which is well known myocarditis, pericarditis. They also we have published myself and Professor Bhaskaran Raman, who is also relative there. So this is actually, I just took it out from the National Herald. We had published this somewhere in December 2022, I think, almost 2 years ago. We had just given the patterns column in National Herald, and this is the data all compiled by Bhaskaran Raman. He will be presenting more data also. This is the global data. This is the data from England and Wales, I think, because they had initially some good data. They had put it across almost access that. So there were a lot of restrictions, lockdowns, and other things on death in nursing home. But after 2020, also you see above the prior to this, this is the baseline. So that's continuing. Excess deaths are continuing beyond up to 2022. We had published this column in 2022. It's continuing, and he will be presenting the data from Mumbai also. This is more concerning. This is the young people, 15 to 44 years old. This is the deaths in 15 to 44 years old. If you see, the deaths in young people are higher than the earlier years. After the vaccine rollout, these are the deaths are higher. So these are the last two bars. So this is again the pattern at the population level is showing, as we have been discussing also, and young footballers falling down, anchors falling down, young people falling down. So these are the individual cases, and people can always write them off as coincidental. But when the pattern is at the large data, population level data, there is something which have to put all these things together. And so all access cause a matter of concern access to young adults among 40 years in many highly vaccinated countries. There is data from USA which shows that after the vaccine rollout, there is almost a 40% increase in deaths in the working population. So these require thorough investigations, including autopsy study. As someone said, the autopsy is not done. And I would say even if it is done, it is not done properly. Most of the we require very qualified pathologists to identify the actual pathology post vaccine. So I think that's all. These are some of the references. All the data I have given references. So these are the references. If anybody wants to uh, verify, these are here, because anything you present, they say it is all conspiracy theory or people are anti-vaccine. We are not anti-vaccine, but we want to see the proper evidence. So these are the here. This is all. I have finished. Thank you. Any questions I can.